Hello, everyone. Thank you for joining us today for World Mental Health Day. I'm Steve Freedland, a urologist at Cedars-Sinai Medical Center in Los Angeles, California, as well as the Durham VA Hospital in Durham, North Carolina. I'm joined here by my esteemed colleague. I'll have her introduce herself.
Hi there, I am Allison Rosen. I am a 12-year early age onset colorectal cancer survivor and very passionate advocate, especially about mental health.
Yeah, no, it's great to join you. And I think we have two very different perspectives, but important perspectives. And I'm going to, just give my thoughts more from the provider point of view, and I'm excited to hear yours from the patient survivor side of things. We hear a lot about physician burnout. The reality is it's real. I don't pretend to be an expert in this topic. It's not my primary area of research, but it is something I'm very interested in. Um, we hear a lot about it, and I think the first step is you look at any 12-step program. The first is to admit that there's an issue, right? And it's okay to say I'm burned out, I'm frustrated, there's challenges. And something I try to do as I go through my day is, each meeting I have, each patient I see, each surgery I do, whatever it is, I try at the end of that to say, did I enjoy that? Was that fun? What were the frustrations in that? It was a really challenging patient, because their disease was challenging, but I really enjoyed trying to figure out the right care for them. Or the patient themselves was frustrating because they were this, they were that. How could I have responded better? And ultimately, try to decide and tailor your practice, your life to the things that you enjoy more. Whether that's the research, whether it's the administrative side, there's a lot of ways as a healthcare provider to be making a difference in this world. And certainly seeing patients and taking care of patients is absolutely one of those ways, but it's not the only way to make a difference in this world. And we go into healthcare to make it a better world, right? I mean, we're altruistic, but we also have to take care of ourselves. Um, and so I think focusing on what gives you joy, what you do like to do, I think is important. I think it's important to take breaks. And when we hear about that, and I'm much better at talking about this than actually doing it. But putting the phone down and not checking the emails all the time and the patient reports and everything, and trying to find that break, whether it's the weekend, whether it's date night with your spouse, or significant other, or just friends. Trying to find that time away. And I think this is something that really, we should be discussing openly, talking about with our bosses as well. Don't be afraid to go to your chair, your boss, your whatever, division head, and say, look, I'm frustrated. I'm burnt out. I don't enjoy coming into work. How can we make this work? And I think as physicians, healthcare providers, we're kind of taught you just suffer through it, and I mean, I think back to my training, and, you know, rightly or wrongly, we had residents who were either mentally, frustrated with things, or remember one of them, had a fever to 102 one day, and you show up to work. You don't call in sick. I mean, that doesn't exist. And so I remember him, being frustrated with some patient in the emergency room. Your temperature is lower than mine. Go home. And we're not providing the empathic care that we want to be. We're not at our best because we're taught you just need to show up. And so I think we need to make sure that when we do show up, we're in that mindset where we're physically able to, taking care of yourself, making sure you're getting the exercise, the rest, eating right, so that when we do show up, we are at our best to help our patients. And we're historically horrible at that. So I think, again, step one is just admit when you're frustrated, when you're challenged. I remember my mom used to talk about, taking a mental health day for shopping retail therapy. That was my mom's thing. And you kind of laugh about it, but I think there's something to it. Just taking a random day and just doing what she wants and just being happy for that day kind of resets the mindset. And you start to realize what a privilege and honor it is to be able to take care of patients and really help and make a difference. And they put a lot of trust in us. But when you're doing it day after day after day with no breaks, we hear about understaffing, in terms of not enough physicians out there, not enough healthcare providers. And it's absolutely true. The wait list to get in to see doctors is getting longer and longer. It's tough for us to find doctors to take care of us. It's challenging. And so patients, you try to overbook patients to make sure that you can see as many patients you can, but that means you sometimes run behind and you walk in the room and it's been half an hour, even 10 minutes, and the patient's starting mad. You haven't even done anything. You just walk in the room, you're trying to be accommodating, and the minute you walk in the room, the patient's mad at you. And it's just, often we're outgoing people, we're people. We like, we want to help, but it makes it challenging when you walk in the room and you're already behind the eight ball to try and make that a positive um, interaction for both you as the provider, but that the patient gets what they need out of it. And where you kind of learn those skills to turn things around, but it makes it a long day. And then, you're working 12 hours, you barely see your family, and you go to sleep and you wake up and you do it all over again and again and again. And so that's the thing. Sometimes you do need that break to build that in. And the challenge is that means sometimes you can't see every patient you want. You can't do everything. And again, there's, the first step is talking to your employer, talking to your boss, and just explaining what your needs are and making sure that your needs are being met. Because when you are at your best, mentally, physically, that's when we can provide the best, most compassionate care, which is what our patients deserve. So, but it starts with taking care of ourselves. Again, it's some random thoughts. I'm not saying I'm an expert in this. There's probably a lot of other approaches. There's a lot of research in terms of, if you have autonomy in what you do, you're going to have a lot more joy and less burnout of things. Things have gotten worse during the pandemic, certainly. A lot of the outside activities that as healthcare providers you like to do, travel, see the world, escape, weren't available to us. You couldn't do that. And so, when you turn on the news, it's all health news and people dying and pandemics and viruses and things. And so it's, now you have a lot of people who kind of don't trust science, don't believe in some of the vaccines and things that makes it difficult for us to do our jobs when we have good data and science to support what we're doing, and patients don't want to believe it. It's kind of, well, why am I doing this? And that's going to add to burnout. I mean, people keep tell you what you're doing is wrong, even though that's not true. It's kind of makes life challenging. So I think, again, admit when you feel frustrated. Is it just a typical frustration that we all face periodically in life and in a day, or is this a broader thing? And it's okay to say I'm burned out. I need a break. I need to talk to my boss and right the ship. And you got to take care of yourself. Um, and obviously, Allison, the perspective from patients, is very different. And
Yeah.
I'm interested to hear your thoughts on this on a really important day here on World Mental Health.
Yeah. I mean, I think the first off, just resonating with what you said, we are all human. So as patients, survivors, caregivers that are listening, your provider, your healthcare team is just human. So there's going to be frustrations on both sides. So, patience is a virtue, empathy is there on both sides and whatnot. So I just think for everyone's mental health. When we're walking into an exam room, we don't know what's gone on that day. We don't know if an emergency happened or whatnot. And also the provider doesn't know what we've gone through in order to get to the healthcare team. So I've always talked about shared decision making and having a great relationship with your provider. So I think that's good for everyone's mental health. But from a patient survivor perspective, as far as like our mental health, when we're going through something regarding, cancer treatment, cancer survivorship, cancer diagnosis. My perspective is my story starts with my first appointment. And granted, I will caveat with this with saying that I worked in oncology. I work in oncology. So I was diagnosed while I was working in oncology. So I might have a little bit different perspective than the average person. But my first appointment, we talked about my diagnosis, what my treatment was going to look like. And I brought up, I would like to see a psychologist or, and is there a support group or is there someone else I can talk to that's a young adult going through colorectal cancer that would understand what I'm about to go through? Because it was so important to me to have someone else's perspective. I had no idea what I was about to do. I had never had chemotherapy. I never had radiation. I never had a major surgery. So I was my own advocate and asked for for mental health help. And I will just say that there was a wait list in order to see somebody, and this was at a large cancer center. Eventually, I did get in within a month to see somebody professionally, and that helped tremendously. The person I saw 12 years ago, I still see today as a long-term survivor. So if that says anything about the importance of taking care of your mental health, I don't know what does. But I will say, on top of that, there are many ways to seek help. You don't have to go to someone professional. You can join a support group, which I did when I was going through treatment. I joined the adolescent and young adult cancer support group, which wasn't sitting around in a circle crying and and all that sort of stuff. It was just having real conversations with real people that understood what you were going through. And no matter if it was the same type of cancer or not, I made some of my best friends through that support group that just understood what I was going through. They were strangers when we first started. And then there's some of my best friends now that I can call on even again 12 years later if I'm having an issue related to my cancer, if just having an issue related to, dating after cancer. They just understand. And then the other aspect of mental health that I've seeked out was one-on-one, mentoring. So there's a lot of programs that are available for patients and survivors. MD Anderson has a one-on-one matching through My Cancer Connection. Anyone, no matter where you're treated, can get matched with a patient or survivor that's very similar, similar diagnosis, similar age, similar stage, that you can get matched with one-on-one, that you call. I signed up for that when I first was going through treatment. I got matched with somebody, and now I am a mentor for other people that are recently diagnosed. Besides that, again, you can use that service no matter where you're treated. You don't have to have been treated at MD Anderson, but there's also groups like Immerman's Angels and all sorts of different groups that provide that one-on-one matching so that you can find someone else that, again, is a perfect stranger. I found that a perfect stranger understood some of the struggles I was going through with, weaning off of pain medicine and all these other things better than someone that had not gone through it. So I took care of my mental health at the same time of, going through my treatment, because mental health, if your mental health isn't right, very similar to what you said, if your mental health isn't right, it's very hard to physically recover or physically go through the day-to-day of cancer, chemotherapy, radiation, surgeries, all the things that have to do with cancer. So, I guess I'm unusual. I'm also a woman, so I'm not shy and I'm not ashamed of saying I need help. So I always tell people when I talk to them, it's okay to not be okay. And how you take care of your mental health might look a little bit different. I know for men, there's a group called Man Up to Cancer. A good friend of mine started it where men seek out support through other men. So it's all men organization for patients and survivors, to just, again, talk to other guys about what they've gone through. And, that's an option. Some cultures, I know it's stigma to talk. It seems as weakness or stigma to struggle with mental health or seek out help for your mental health. I'm here to break that stigma or to tell you it's okay to break that stigma. Crying helped me so much. And then when I wasn't crying, I will say I did a lot of punching. I went to workouts where I was just punching a bag, and that helped me as well. That might be a source of support for somebody going through treatment as well. It might not be talking to other people. It might just be going and finding something that brings you joy, very similar to what you said as well, that you can take your mind off what you're going through. Because when you're immersed in cancer treatment, it consumes your life. So to take yourself away from that when you are feeling well and do something you love and enjoy is very good for your mental health. I did things like restorative yoga. I went on wellness retreats. I again went to work out and was punching a bag because I was like, why me? This is not fair. And again, like, it's not all rainbows and butterflies. It's okay that you're mad. That is a realistic feeling for you to have when you're diagnosed and or going through treatment at any point in time. If things don't end up how you want, or there's a curveball thrown your way, again, seeking help some way or another, professionally, through support groups, through other people that get it, I say is like one of the most important things that helped me. I really think that without that help, that mental health support, along with the again my healthcare providers that were treating me physically, I don't know if I'd be alive today, because the depression was real, the anxiety was real, all of that was real. And if I just let it like sort of boil up inside me and not take care of it, it would have been very, very difficult for me to get through everything that I did. And I'm not, I know there is research out there that shows that if you do take care of your mental health, it increases. There are some hormones that are activated. Again, I'm not 100% sure. I'm not a researcher. I'm not an expert, but I know that I've read stuff that says if you take care of your mental health, that triggers something that actually helps you recover faster if you have surgery or sort of certain types of treatment. So you got to take care of your mind, body, and soul when you're going through treatment. So that's sort of my take as a patient and survivor, who, again, seeks out care and tells everyone that they are their own best advocates to ask for help. Again, it might be a social worker, it might be a counselor, it might be another survivor, it might be an online community. There are online communities, if you're not comfortable talking one-on-one, that exists through a lot of cancer advocacy organizations that, again, colon cancer specifically, there's Blue Hope Nation and there's Colon Town. And both of those are online forums where you can go in and ask people that have gone through it, hey, this is what's going on. Do you have any feedback? So I think, and they're private. So, there's a process to get into these groups. And they're not open to just everybody to join, because there are people that might not have the best intentions. So Colon Town, there's a whole process. There's neighborhoods. There's moderators in the neighborhoods. I'm in charge of the Texas group, where again people can ask different things like medical. Although we're not providers, they can't ask things like, "Oh, did this work for you? Did this work for you? What should I do?" They can't ask questions about specific medicines because we are not providers, but they can ask, hey, did you have this, did you have neuropathy as a result of your treatment? How did you take care of that? What did you do to help prevent it from getting worse and whatnot? So again, World Mental Health Day is huge. I always take a second to remind myself that I'm alive. I'm alive for a reason. I'm alive to share my story and help others. And if that is, a quick conversation with somebody that's going through it, or if that is going to a support group and sharing my experiences, that someone else did that for me, and now I do it for others so that they realize they're not alone.
I think that's great. And I really appreciate you, Allison, sharing that. And it was interesting when you were saying about the depression, and how real it was. It reminded me of the statistics that when people are newly diagnosed with cancer, we see that the suicide rate goes up. And even the suicide among people who have very curable cancers, long-term, excellent prognosis, the suicide rate goes up. And we see that among physicians. Physicians have higher suicide rates than national average as well. And it's dealing with healthcare, whether you're on the physician healthcare provider side or the patient side, it's not easy. It's challenging conversations, taking care of patients, and it's all well and good. It's a well patient check and everything's great, but not every patient you're going to encounter is doing well, right? And to be that patient that's not doing well, a physician trying to deal with that. And it reminds me of It's interesting. One of my wife's really good friends is a school psychologist, and you can imagine the things that kids, I mean, there's the usual stuff, but there's some really heavy things that kids deal with these days. And basically, it's a requirement that all the school psychologists have a therapist of themselves, that they can like offload their issues onto someone else. And I think it's great as a patient. Not everyone is open and receptive to that, and it's you want to meet the patients where they are. But I think for providers as well, again, to be open to, I certainly wouldn't say every provider needs a therapist, but I think if you're open to that, it can really work wonders. And whether you call it a therapist or a life coach or executive coach or whatever you want to call it that makes it sound better, they all have a lot of similarities to them. And again, whether which no matter which side of the table you're sitting on, we need to take care of ourselves. I think that's the moral of the story. And hopefully, I don't know if you have any final thoughts, Allison,
Yeah, I mean, I think my final thought is really that we're in this together, and taking care of your mental health, your physical health, and talking to somebody, even if it's your provider or someone else that's gone through it, or someone else that you just trust, to realize you're not alone in this. The last thing anyone wants, your healthcare team or advocates like myself, is you to feel like you're alone when you're diagnosed, and it's a scary place to be. And so really taking care of your mental health is one of the best things you can do for your physical health. I say that because, again, if I had not seeked out other people that understood what I was going through, my life story, my cancer journey would look quite different. And so I think we're in this together. So trust and empathy with your healthcare system, your provider, and the people that are going through it. And I really do think that this day is really about finding what works for you for your mental health. Again, it might be support, or it might be finding what you something that you find joy in, as far as life's concerned. Going on that trip, going on that date night, going to that gym, whatever can sort of take your mind off of what you're going through, because you can become all consumed in what is going on. And you have to remember, I always tell people, there's a light at the end of the tunnel. There are times when you're going through cancer that it is a roller coaster. It's not all bad, but when it is not great, there are people to help support you.
absolutely. No, it's a great message. Again, whether you're a provider, whether you're a patient, whether you're both, there is help out there. Look for the little joys in life. So, and then on that note, again, Allison, thank you so much for joining us. And I hope to the viewers that watching this brought you a little bit of joy and a new perspective on things. And we wish you the best mental health on World Mental Health Day. Thank you.
Thank you.